Well, good morning. Today is October the 14th. It's a happy Wednesday. I have the pleasure today of interviewing and speaking with the founder, co-founder of the company called Wryst, which we're going to introduce today, is one of our best-in-class technology providers for TheraCann International on our projects. And his name is Hermant Maini. And Hermant's going to introduce his company briefly with regards to what it does. And then we're going to talk about why we feel it's best-in-class technology for what we do, which includes vertical urban farming. So Hermant, welcome. You're dialing in from London this morning or this afternoon. How are you?
I am. Thank you very much for having me. I am doing well and very excited to be on this podcast.
Well, thank you so much. So TheraCann was approached by your company a little while ago, and you had a very novel solution that caught our eye. And for full disclosure for our audience today, we have entered an agreement to help distribute your product within our projects, including our Center of Excellence here in Panama, which is sitting right behind me here in Panama Pacifico. Tell me a little bit about Wryst, what makes it novel, and then we're going to talk about why we feel it's best in class. Go ahead.
Absolutely. So, rewind back to February, and we were in a place where we were building this solution, which was going to allow people to clean their bodies on the go. So it was a soap or shower gel solution. And having touched base with some scientific advisors, we saw an opportunity that we hedged our bets that COVID is going to be a big problem. Some people were saying this is going to pass in months or weeks, but we thought, you know what, it's going to be around for a while. There's not going to be vaccines anytime soon. I think the fastest record for a vaccine was 5 years. Said, okay, let's actually pivot to building a solution that's going to allow people to clean their hands on the go. Mm-hmm. And our original thesis was that this is going to be a consumer product where everyone on the street is going to be wearing one, and that's what they need to be doing. And yes, we still believe that, but where we actually saw the majority of our early interest coming from was from enterprise businesses. And what we went down the path of doing was building a solution that would allow an individual to clean their hands wherever they are. And I'm wearing it today, which, is simply,
this on the web.
Sorry, that's my Apple Watch. It sits on your wrist, and with the press of one button, it dispenses sanitizer into your palm and you can clean immediately. Avoids any friction of having to find a sanitizer station on a wall, a bottle in your pocket, etc. The next steps for us is now, this is not a smartified product yet, but my R&D team and my product team are working hard on building a solution which is going to be dedicated for enterprise. And what we really want to do is, we want to be ahead of the curve on this consumer behavior change, whereby we will allow companies to be tracking how frequently people are cleaning their hands and feed that data back to facility managers, compliance managers, logistics managers, whoever it may be.
Yeah, that's brilliant. And that's exactly what we're looking for. So as our listeners know, we plan, design, implement, and manage what's called current GMP, cGMP compliant facilities globally. And one of the big challenges for a cGMP facility is to ensure hygiene. And not only do you have to have standard operating procedures well in play, but you actually have to record that they're actually being utilized. And having an app such as yours, and we're both wearing, I'm the other guy, I'm the Samsung watch, you're the Apple Watch. So there we are, 80+% of the international market right there, tracking all of our day-to-day, our exercise, our water consumption, everything else we want to measure. And coming from a GE world, where I was director at GE Cap, you can't manage what you don't measure. One of the big issues that we've had in large-scale warehouse facilities is primarily twofold, especially in urban farming. One is you have to walk hundreds of meters sometimes to get to a wall that has a dispensary, only to find out that it's empty. It hasn't been properly recharged. And walking all those extra steps is downtime. That's not usable time for an employee. That's number one. Number two, you don't know if they did it, other than maybe it's empty. But that could be one individual that goes crazy and the other 5 have done nothing. This brings it back to the individual level. And being able to show that the key individual or individuals are doing this regularly and routinely is important. So tell me a little bit more about your Wryst, and we'll talk about, again, some of the international applications we see for it. But how long does it work? How many charges does it do? How do you recharge it every day? I know, but for our listeners, enlightenment.
Yeah, absolutely. So we wanted to make something which would be frictionless to use. And, so we looked at various options. We started with 3D print prototyping, and we got people using it, and we said, okay, let's just monitor how people go about using it. And let's see what questions pop up. And, people were saying, okay, is it refillable? Or how does it work? So what we did was we actually created an innovative cartridge model. So what sits on here, this will get you around 15 to 20 dispensers. And if you're washing your hands as frequently as you should be, that should last you a couple of days. And what we did was, when I say cartridge model, when it runs out, you simply pop it out open like this.
Right.
And you just insert another one of these pods back into the device, and you're good to go. It's a process that takes seconds to get done. And it's a very seamless procedure. We saw a lot of other solutions. People were trying to do similar things, and they had these syringes that you get along with it, and then you get a sanitizer bottle, extract the sanitizer. You have to use a specific syringe because the hole is immensely small, and squeeze it back in. We said, let's take that all out. Let's just create a swap model like that. So that's how it works. It's one-piece silicon, so it's sort of bacteria resistant, and we're working on a sort of sustainable model as well. So it is a very, very easy to use solution. And in the future, what we're looking at is introducing things like motion dispensing. So you actually don't have to make any contact with the device. You simply just swipe over and it dispenses into your palm. It will feed you back onto your Samsung watch or my Apple watch. It will tell you that, there's 10 mil remaining or 5 mil remaining. And it will alert you, it will notify you as to how frequently you should be cleaning your hands. Pop up, you haven't washed your hands in 2 hours.
Brilliant. Yeah, the rule that we've employed for all the technologies that we put in our facilities, and this includes everything from production to processing to distribution to destruction to on-site analysis. We've covered vertically the entire business of vertical cultivation, whether that's for your groceries or whether it's cannabis or other entheogens, other psychedelic plants that are under license. Complex processes. But the technologies that we've selected always have to meet a common principle of our company, which means it has to be repeatable, has to be economic, practical to use, scalable, safe, and secure. And what I like about your system, and this is what attracted me, is that no matter how many employees we have in a facility, we can all be sure that they have the right number of sanitizer solutions. And it's easy to scale. If we bring on more people, give them more Wryst. If we take people off the facility, take off Wryst. It's just that simple. I don't have to worry about running around doing a head count as to the number of dispensers. Now here in Panama, we had one of the most severe quarantine rules on the planet. Men and women couldn't go out on the same day. You were able to go out for an hour twice a week. It was ridiculous, but they had no easy way to contain the spread of COVID here with a very limited access to very high quality hospitals, but they didn't want to overrun them like we saw in New York, and that was the fear here. But they didn't have anything measurable. In order to open a facility like the one behind us, it now has to be physically inspected, in our case by 2 authorities, and we have to demonstrate that we are proficient in being able to manage this pathogen. So perfect solution for us, very cost effective in our opinion as well, which again is head and shoulders above what we would see as direct competition. So that's awesome. And I like where you're taking it. Ultimately, to make a hot swap cartridge is much more practical to recharge. And we can do that at the front door. The way we have ourselves set up, and as we're writing into our standard operating procedure for clients, as staff have to come in and register the start of each day anyways, that is when they're given their new cartridge and put back out onto the floor. And if you can capture how well they're doing everything on their device, then for sure that's even better. Super cool. So what are your challenges? What do you see as being challenged? It looks like you pretty much figured it out, but what else?
So, We believe that, and what we have seen is that one, hand washing compliance goes through the roof when you put something on the wrist. So that was challenge number one. Where we were testing against the bottle, and it won that. I think going forward now, it's mainly going to be product development challenges. It's going to be what data is important, how frequent we can get it back, and how we can get something like this even more seamless to the body, even smaller, and how can we get that talking to a device on the other wrist? So one of the biggest challenges is your real estate is limited. You've got two wrists, and that's at the most. And how do we get, how do we challenge for that prime real estate? Because someone's going to say, I'm wearing a watch, or I'm wearing another wristband.
Right.
So it's that, can we build a solution that's integrated into a strap, or, what can we do? Can it be a clip-on, where it just clips onto an existing smartwatch?
Exactly.
So that's one challenge. Second challenge is, we were actually discussing this offline, which is, countries are recalling sanitizer. There's been a whole host of fake PPE that's been handed out, whether it be masks or gloves or aprons. Now, what that's done from a regulatory perspective is that certain countries now independently regulate sanitizer, especially if you're using ethanol. If you're using isopropanol, it's a bit different, but our factories are, FDA approved, they're CE marked, etc. So, whenever you think you've got something covered, when you go into a new country, you have to abide by their regulation. So that's that challenge going forward.
Well, I'm glad you brought it up. Canada had reported this morning through Health Canada, you had recalled 4 major providers of hand sanitizer this morning. So very active in being tasked with finding product that is approved within their country, right? So I can only imagine that if we were to bring a solution like this even to a Department of Health and show that it's working well in other countries, it'd probably take a burden off of them.
Absolutely, absolutely. And I think the key for us will be, as well as, yes, we can make our own sanitizer, but I think the future, and in order to get scale, it will be partnering with global players, your Perels or your Detol's, your Lifebuoys, which is owned by Unilever. It's getting partnerships with these big players that have the distribution channels, and they've got that regulatory aspect sorted out, where we can build lasting partnerships with, and on a supply side.
In terms of its use, and as you said, you're geared to a business-to-business market, which is very clever in the early days of COVID. Do you help these companies with standard operating procedures at all, or what else are you providing in addition to the device, the wrist itself?
Yeah, I mean, so there's a little bit of on the side of educating them around, it's not just give them one of these and walk out. It's more, making sure that they understand that the purpose of this is to enable hourly hand cleaning. That is how you mitigate the spread of disease and infections. So obviously it's not the only solution, but it's one of the factors. And it's about going and teaching them, okay, make sure you're using this on an hourly basis. Make sure you change your cartridges, so there is a bit of a whole education piece around it. Now what makes our life a little bit easier is that a lot of countries I've seen are launching national campaigns. In the UK, we've now got a standard TV advert that comes on virtually every channel, which encourages people to socially distance, wear a mask, and wash their hands. Mm-hmm. So, that aspect of it's also being aided, for us, where we believe that is that human behavior is moving towards actually thinking, I need to clean my hands on a regular basis.
Well, I'm glad you mentioned, and I totally agree with you. Like in my lifetime, I went from a culture of no seatbelt to seatbelt. I went from a culture that everyone smoked to no one really smoked much anymore. I never did, but it changed literally overnight. And if I think of all the other hundreds of social changes that have been going on in the last generation, this is the next one, and for the next generation as well. How they will even shake hands. I've yet to shake a palm probably in 9 months now. Everybody is elbowing, which is interesting because you don't eat with your elbows typically. So that helps. In this business, of course, of wearing your mask in public, may very well become a normal. And I find that that is a substantive change. We may not keep all of it, but definitely the hand sanitization I see as being a requisite. And certainly within business that's handling food or other human consumable, that's going to be part and parcel of the industrial hygiene standard operating procedure. I don't see that ever changing. Over the last 11 years when I worked at Benchmark Labs as CEO, and we used to do a lot of swab testing and taking a look at the hygiene of some of these facilities, including meat handling, poultry handling, even leafy green handling, mushroom handling. I was quite surprised at what they were getting away with. High incidence of Salmonella, E. coli, Listeria, Campylobacter, and now COVID. So being able to manage and mitigate that, I don't see changing. And that's a good thing for food security, as far as I can tell.
I agree. And, you're absolutely right. We identified certain sectors where, these are the businesses we should be talking to, and agricultural farming, anyone handling food, even to the front line of that, which was restaurants, etc. We believe that they should be wearing a wrist. Because you're right, it's not, so it's kind of it's a two-pronged thing, which is, one is, yes, keep your workplace safe, make sure your employees are safe, make sure the products you're creating are safe. But what does that lead to? That then leads to customer confidence. I know as a customer that if I'm buying product from this organization, or if I'm eating in this establishment, I know, okay, they have a certain safety standard, and I trust in that. So that's why we've actually considered launching a sort of Wryst mark of excellence, which is, you may have seen your sort of Michelin guides that you get, or something is 3-star rated or whatever it might be. We thought of Wryst certifying organizations. So people know that, all right, these guys all have a hand device on, they're cleaning their hands on an hourly basis. They take hand hygiene very, very seriously. And it's a guide factor where people know, when they walk past it, or they look at it on packaging or whatever it might be, that we trust this organization. But like you said, you mentioned farming, agriculture. Anyone that's dealing with a product that's getting to an end consumer, or anyone that's dealing with mass gathering events. I mean, look at sports, look at travel, holidays, hotels. All of these industries have been.
Well, let's talk about air. So at some point, executives like you and I have to get flying again. And I'm looking to sites I have to see, because we're well behind schedule for project starts and site openings and the rest of it. And we're going to be on airplanes, and we have to take something with us that doesn't get seized as we're going through the checkout counter of inspection, right? And we used to laugh when we'd watch our counterparts lose their fingernail polish and everything else. Well, now we're trying to keep a hand sanitizer to a level that will make it on the plane. Do you see any issues with taking risk with us when we're traveling at all?
Oh, cool. So I know a couple of people that have flown already, and they actually said Wryst was their best friend when they were flying. So I'll give you 2 examples. One was actually a decently long haul flight, and this individual said, when they got on the plane, they sanitized their hands. Right. When they got on the plane, before they got their food, they sanitized. After they ate, they sanitized. Right. Rather than going to the bathroom, they were a bit worried. So they sanitized before, after, when they came out, sanitized again. You touch a door handle, or you touch the part to get out. Yeah. You're touching side rails, etc. The other was an interesting example, and something that you touched on earlier, which was they went to use a sanitizer dispenser in the airport, and it wasn't working. It had run out. Now, in an airport, who do you go and find to tell them, please, can you fill this sanitizer station? And you're touching so many things. You're going through security, check-in, you're touching things in shops, in restaurants. So they said it became their best friend. They must have used it 10 to 15 times just in an airport alone. Yeah. So that was kind of validation for us, which was, in travel, this is your companion that you need. Yeah.
Well, I agree with that. And last comment on it, and then we'll sum up here. But I'm a process guy, and I'm trained in following procedures. And one thing that I've kept a very keen eye on for the last 20 years since GE was the process of going through inspection at airports and in watching the horrible inefficiencies. Some are getting very good at it now. But the one thing I noticed, and I'd share for my viewers, have you ever watched them ever clean the belt that your stuff goes onto, or the buckets? Ever. Never, right? And if that was a grocery store, usually like here now, between, we'll call them guests at the store, just for lack of a better name, but the cashier is required to clean the belt before the next person puts their food down. And I thought, well, that's pretty clever, because the airports never figured that out. And yet they're doing the highest volume. and it's people's stuff that they've touched. It goes onto the belt, and then it comes up on your gear, and you think, well, I never touched the handle, but you picked up your gear off a dirty belt, right? So technically you've contaminated your hands. But we'll leave it there, because that just gets gross, and we don't want to talk about that. All right, well, cool. Well, thank you so much for coming on the call today. I'm going to ask you if you have any sum-ups, thoughts, or any other opportunities that you see for business that we should be aware of, or did we pretty much cover it today?
No, I think we've covered it. I mean, my main point I'd leave you with is that I think anyone that thought this was a fad, it definitely isn't. You know, this is not a passing wind. That's passing shower. You know, this is something that even if we get a vaccine, it's something that we're going to have to live with. But most importantly, this is not the last pandemic we will have. There is science out there to prove that we will suffer more and more pandemics of diseases we have not yet discovered at a faster rate than ever before. And we have to mitigate that. And we have to do things about it. We have to take steps. Now, Wryst isn't it's not a cure to all of those problems, but it is a step you can take to, protecting yourself. And in turn, that protects another. And it has a virality effect whereby even if you're not using Wryst, you're still cleaning your hands on a regular basis.
Right.
That is what will eventually spread and protect the millions and then the billions. So that's the thing that I'd probably finish on, is that it is of paramount importance. Hand hygiene is going to be here it's going to be here for the foreseeable future.
Yeah, I'm very much for that. I'm always the one to look for the root cause of the problem. And as I say, as we were chatting a little earlier, most of the countries are allowing, or I think it's prudent to allow, it's just the consumer to test and clean and deal with their issue between, let's say, fridge and table, for example. Nothing's tested to get to the store. Nothing in the store is tested before it gets into the fridge. It's up to you as the final consumer. And therefore, you put your entire faith on the person who made your food not to make you sick or kill you. So removing the root cause of that issue back at the production level is imperative. And I'd say for those manufacturers in the world that ignore that, they're willfully blind. And the ones that are, depending on the jurisdiction, can be criminally willfully blind and put in jail for up to 10 years. So we're very much aware of that. We're not willfully blind. We see this as a real risk that needed to be mitigated. And I really thank you and your company for coming to the rescue and look forward to working with you in the future. For our viewers, my name is Chris Bolton, CEO, founder of TheraCann International, and of course our subsidiaries operating globally. We will be putting a link to Wryst and their lovely website up this morning onto this podcast as well. And please feel free to share, as it will be an open public YouTube video. Any other questions, of course, please reach out to Hermant and find out a little bit more about what he's up to and where he's going. See a great future in this. And given some of your investors and founders as well, we're looking forward to some really novel and cool things coming. So thank you so much.
Absolutely. Thank you for having me on the show. And I look forward to doing a lot more of this with you.
Fantastic. All right. Well, have a good afternoon in London. I trust the weather will cooperate, and we'll look forward to our next chat in the future.
Absolutely. Thank you very much.
Excellent. Here, I will end now. Thank you.